Okay. Welcome to Preventing Knee Pain with Weekend Warriors. Our group has worked hard and tirelessly to give you this prevention program, so here it is. So let's start with what a weekend warrior is. One of our sources defines a weekend warrior as recreational athletes who compress all of their physical activity into 1 to 2 sessions, but it's typically on the weekends. So it's like really vigorous activity in 1 to 2 sessions a week.
So most common injuries for weekend warriors is typically because they're just doing too much too soon, or overuse injuries like runner's knee, so patellofemoral pain like around the kneecap and beneath it. They also can get meniscus tears or exacerbations of underlying degenerative changes like OA or things along that line. Although not as usual, they may also present with ACL and MCL tears.
So again, why are these weekend warriors at risk? Just because they are not to exercising all the time, like all throughout the week, they could have poor form in their biomechanics because they're not used to the movements, not as good flexibility, they don't have enough recovery time between activities, so that could cause fatigue and increase the risk of injury. Again, lack of consistent exercise throughout the week, and all of a sudden intensity, that could also cause a high risk of injury, especially at the knee, with all those forces acting all at once, and again, lack of motor control due to poor form.
All right, why exercises can limit risk factors. Having strong muscles around the knee can help promote stability and reduce the chance of injury. There's also improved body awareness, which can contribute to coordination and safe execution of movements, which can also help prevent injuries / unnecessary strain. Lastly, it can also help delay the onset of osteoarthritis, which is a degenerative joint disease.
So prevention for this population is really important because weekend warriors are at that higher risk for injury than a lot of other populations. And this is because the nature of their activity patterns being very high intensity on the weekends and then not training for that intensity during the week. So they require more balance and motor control than sedentary populations, but don't train as much as consistent athletes to be able to maintain the injury prevention necessary for that level of activity. This means that the insufficiencies in their balance control means more injuries are due to falls and incoordination on the weekends. And so as we prevent these injuries from occurring, the tactics are shown to decrease risk of injury because it increases the motor control, balance, and reaction skills that these weekend warriors need in the extreme sports that they like to do on the weekends.
So for specific exercises to strengthen the knees and for, quote, bulletproof knees, you want to focus on both open and closed kinetic chain movements involving lower extremity. So open kinetic chain movements involving the distal portion or the extremity not touching the ground, and then closed kinetic chain like a squat with the feet planted on the floor. These exercises should also target muscles at the hip and knee, with additional importance on strengthening hip abductors and external rotators. So specific emphasis on muscles like glute med, glute max, TFL, and then additionally, you want to focus on neuromuscular and proprioceptive training, as according to Dargo et al., it led to a decrease in the incidence of injury to the knee and specifically incidence of injury to the ACL.
Okay, so why will this work? For a recap of benefits, some would include physical, mental, social, and cognitive advantages. Reduction of preventable injuries will reduce healthcare costs associated with obtained knee injuries, and movement is medicine. Individuals that take care of their knees through regular exercise will have healthier knees for longer and may prevent common age-related pathologies. Injury prevention is a key component of trauma care. Educating patients on prevention exercises brings their attention to the risk of leading sedentary lifestyles with sudden increase of physical activity, and home maintenance that involves climbing ladders or physical stability at the knee can be a risk to those with sedentary or sporadic high activity lifestyles without preventative measures. And here's our references. Thank you for watching.
Thank you for watching.
All right, so we're going to be starting with a double leg squat. So I have my patient Ireland here. So for the double leg squat, what we're focusing on is really engaging the lower extremity. And so we're starting here because we want to incorporate functional mobility for these patients and incorporating strengthening all of the lower extremities coming up the chain, starting at the ankle and going up towards the hips. So for this exercise, Ireland, so I want you to just focus on keeping your hips shoulder width apart and your feet underneath your hips here. And then you're just gonna like sit back as if you were sitting into a chair. And then I'm gonna place this band around the outside of your knees here, and you're just gonna push out into this band so that the knees don't fall in. Does that sound all right with you? All right, so I'm gonna place this band around here. Hold on if you need. So, and then you're just gonna keep that tension out on the outside of the band here, giving tactile cues here. So pushing out on this band as you go down into the squat, keeping those hips back, hinging at the hips. And then she's pushing out against the band there. I'm looking to see if her form, we're also looking for good form because we want to progress these patients to more advanced exercises in the future. So maintaining that form, making sure the knees are coming over the toes or at least in line with the toes. And she's not doing anything weird like any valgus or any dynamic movement during the squat. Ireland, for this next exercise, we're going to be doing what is called an anterior step down. So I want you to place your shoe, your left foot's going to be on the step here, and then your right foot's going to be hanging over the edge. You're just going to try and keep this knee nice and straight as if you were coming in line with your first toe, like that, and then you're just going to come straight down, tap your heel. And as you're coming back up, you can hold on if you need to. Try not to use your both hands, just use fingertips if possible. Come back up, and then slowly control the knee as we come back up. Trying not to let the knee fall in, trying not to let the weight shift to this side, just trying to stay nice in a uniform line here, tapping here. So have you try that? Right foot hanging over the edge, tapping there. Good, and then nice and controlled as we come up, and then I want you to keep this knee from falling in, so keep that nice and straight as if you were going straight down over your toes. Good. All right.
So we're going to be doing some hip abduction with this ball here. How we're going to do this, I want you to have your feet planted right here. We're going to take this squishy malleable ball, place it in between your knees, close to the end there, and then keeping your knees forward, not like caving them in, but just bringing your thighs, pretty much squeezing them together. And we're going to hold that for 10 seconds. We'll do a 10 count, 1, 2, 3, 4, 10, and relax. Still keeping that ball in between, maybe like 10 seconds off, and we're going to keep on doing that. And that's going to help strengthen our hip adductors, which can promote a good hip alignment and help relieve any sort of stress or tension on the knee with those muscles being a lot stronger. So the next exercise we're going to do is going to be a single leg stance. We're going to do it on this foam pad. Okay. So we're going to have the railings right here in case you need it for any support with this exercise. Is to improve your balance and stability.
Gotcha.
So we're going to go ahead and you can fix this direction. I'll come around here to help cue you. That railing is there if you need it, but we're just going to keep your right leg on the phone, lift it up and bouncing. If you're having trouble, try looking at a certain point and just fixating on it.
Gotcha.
And we're going to hold that for 30 seconds and then relax, and then you can switch legs and do the same.
Sounds good.
That looks good. And if you don't need that railing, try perfect. Go ahead and relax.
Okay, so we're gonna be doing banded lunges with like external rotation resistance. So this is gonna be for strengthening and stability. So you know when people lunge, you know if they don't really have good control, they'll tend to go in with their knee kind of like this. So the band is here to act as a tactile cue to make sure you are pushing out. That way when you do the lunge, your knee stays in control and straight, okay? So let's go ahead and try that.
Okay, and then I just step back and lunge.
Step back and lunge. And make sure you are pushing out with your knee, that way it doesn't go in. Okay, one more time. Perfect. Okay, so next we're gonna do a single leg squat. We're gonna do it banded for a terminal knee extension. So you're gonna squat down and then come back up and then really pressing back with your knee. This is gonna help with motor control and strengthening, okay? So let's go ahead and try that. Okay.
And then does it matter front or back?
I would do it in the front. Yeah. And then really push back with your knee, and the band will act as a tactile cue. Good.
Okay, so for this one, we're gonna do a step up with a band around your knee. This is gonna help you maintain stability as you do the step up and really activating your external rotators of your leg to make sure that your knee doesn't do any inward rotation or dynamic valgus. So basically you'll have the band around your knee and then step up nice and controlled and then lower back down nice and controlled. So go ahead and give that a shot.
Just right underneath.
Yeah, so it'll come up on the knee here. Then start on the floor.
Okay, and I'm bringing this knee on the step too.
Yeah, so we'll just start with 2 feet on the ground and then you'll step up from beginning to end. Yep. Okay, so that we're gonna go a little bit slower. And then we can scoot in. I saw a little bit of inward rotation there, so we're gonna take out some of the stretch of there. And go ahead and think about driving your knee out towards my hand.
Like pushing out.
Yep, as you step up. Good, that was better. Awesome. One more time. Perfect. Sweet. All right, so this next exercise is going to be a single leg RDL. And this one is going to, again, strengthen all the stabilizers in your leg all the way down to your ankle. This is a really functional one because as you go down, you want to think about keeping your back straight, bending at your hip and your knee, and coming down to pick up the ball like this, keeping your knee in line. So lots of things to think about, but as you focus on the ball and lower down nice and controlled, you can do that movement nice and in line with everything straight up and down. Does that make sense? Okay. So, yep, one leg. If you need to drop your toe for balance, go ahead. I'll be right here as well.
Then I'll just squat down.
Yep, so then you'll bend down at the knee and the hip. Good. Nice. Good, and that's one. Very good. Nice straight back, bending at the knee and the hip, and keeping that knee in line. Looks good.
So for the next exercise, what we're going to be doing is a box jump into a depth squat. So what I'm going to have you do is you're going to jump up onto the box. What we want to focus on is just making sure we're really engaging the glutes so that we're not bringing our knees in together, okay? So you're going to jump up onto the box and immediately you're just going to jump off and you're going to go down into a deep squat and then just pop back out. Yep, so you're going to kind of think about keeping your booty back and your back straight.
Okay. And do you want me to stay here or do you want me to?
Yeah, we're gonna hop up out of it.
Okay.
So we're gonna go jump up onto the box, and then we're gonna hop down into your depth squat, and then you're gonna jump back out of it.
Okay.
So just pop back up as quick as you can.
Okay.
Okay. So we'll do it slow the first time.
Okay.
Slower.
Okay.
Okay. So go ahead and jump up onto the box. Good. And then you're gonna hop
down and go into a deep squat. So you're gonna think about sitting back, good, and pop out. Yep. Okay. So we can do that and all the way through if you're okay doing it again. Yeah. Okay. So up, deep, and pop up. That's strong. For the next exercise, we're going to be doing what's called a T-test agility run. So we're going to start at this back cone, running up to this cone here. Once we get here, we're just dropping nice and low. And then we're doing like a little side shuffle here, staying low the whole time. And we're just, again, going to make sure that we're engaging the glutes. Just really sitting back into it, back straight, and don't let your knees come in, okay? So I'll show you just on this one side back to the middle. So we're running to the middle, and then we're going to go down low. We're going to side shuffle all the way down to this cone, side shuffle back. And then once we get back here, just a little back lunge jog to your first cone. Okay? But I do both side shuffles. Yeah, so we're going to come up, shuffle here, back to the middle. We're just making a big T, and then to the back. Okay. If you're ready, go ahead and start. Up to that cone. Good. Nice and low. Keep your back straight. Good. And then
that's good. That's what we want. So that's what we're kind of practicing.
Nice job.
So I want you to do this.
Okay, so now we're gonna do some lateral bands. I have my little leash here on Amanda. Just kidding. So what we're gonna do is she's gonna jump out and she's gonna land on one leg, and we'll do a progression after that. But so you as a therapist, you're gonna hold just enough tension so that she doesn't fall over. You don't want to make her fall over, but just enough tension that it's a challenging movement for body control, motor control, and just knowing where her body is in space and time and stuff like that. So you can go ahead and do this first side. Yep, and then she'll do it again. But yeah, just do it again. And you'll have them hold for a minute before they come back. So the next one is the progression. So they're gonna jump out, and then they're gonna jump up and down and try and hold that on the way back down. And then hold. Yeah, just like that. And we'll do it both sides. Okay, so this next one we're gonna do like a high knee hold run. So it's gonna be a 1, 2, 3 pattern, and we'll hold on 3. And we're gonna do it on this Bosu ball to kind of test balance and mixing it in with motor control as well. So it's gonna kind of look like this, okay, Amanda? So you're gonna go 1, 2, 3, hold for that stability. And I'll go 1, 2, 3, hold. Okay, and then when we get there, we'll kind of randomize it, okay? Okay. All right, ready to try? Sure. Okay, so 1, 2, 3, hold. Good, okay, and then 1, 2, 3, hold.
It's a little worse on that one.
That's okay, that's okay, we know where we are. Okay, and so now for this more complex one, you're just gonna keep going until I say hold.
Okay.
Make sense?
Yeah.
Okay, ready?
Sure.
Get the reaction time. Okay, keep going, hold.
Oh my god.
Good. Okay, one more
Terrible.
try. One more try. Keep going.
Oh.
Keep going. Hold. Good.
Okay.
Good job. And that's it.